Hello everyone, welcome to my YouTube video channel. My name is Morolake Ajibola. I'm a registered nurse. If you are viewing my video for the first time, I welcome you to my channel. And to my subscribers, thanks so much for subscribing to my channel and God bless you. My channel is all about enlightening individuals about some health challenges which can be prevented if individuals has the knowledge to do so, and also to talk about some health challenges which need to be managed appropriately in order to prevent complication. And mostly I use my channel to talk about women's health. And today again I'm going to talk about a condition, health decision that actually affects women alone. And what I'm talking about today is induction of labor. Maybe as a pregnant woman, your doctor, obstetric and gynecologist has actually planned or booked you for induction of labor, and you actually want to know more about what it entails to actually plan a pregnant woman for an induction. If it's something that you like to know more about, come along with me. Welcome to my channel again. Like I rightly mentioned, that I'm going to talk about induction of labor. What is induction of labor? Induction of labor is artificially starting a labor. This is artificially initiating the contraction of the uterus for the ripening of the cervix, which cause the dilatation of the cervix for the delivery of the baby. So we have to have it in mind is that this is the purpose of induction of labor. And the main reason why a pregnant woman is being planned for induction of labor is to prevent maternal morbidity and mortality, and also to prevent neonatal morbidity and mortality. So this is very important. We should have it at the back of our mind that the main purpose is to prevent maternal mortality and morbidity. That is the reason for induction of labor, for our own interest. For a woman to have an healthy baby, to an healthy woman and an healthy family is so important. And what are the main reasons for obstetric and gynecologists to plan a woman for induction of labor? There are two main reasons for it. Number one is due to medical reason, or it can be an elective reason. Maybe it's due to the reason from the pregnant woman by herself. The first purpose is for medical reason. And what are the medical reasons that may actually make an obstetric and gynecologist doctor to plan for induction of labor? Number one, due to intrauterine growth restriction. When a fetus in utero, the baby in the uterus is not growing according to the expected gestational age, and there is nothing to point to what is actually causing this problem, there may be need for the delivery of that baby. If the baby is viable, if the obstetric and gynecologist actually sees that in delivering the baby at that particular period does not pose a problem to the woman, and likewise it does not pose any problem to the baby as well. So when they feel that the baby is not growing very well, there is need to plan for the delivery of the baby, so that all the nutrients and all the support that the baby will need in order for the baby to grow according to their age will be provided for them after their delivery. So it's so important. Another medical reason is for the woman's health herself. Maybe the woman is being diagnosed of pregnancy-induced hypertension, and the obstetric and gynecologist sees that if the woman actually continue with the pregnancy, this may lead to complication of pregnancy-induced hypertension. So it's more preferable and more safer for that woman to plan for an induction of labor. Another medical case that may make the doctor to actually plan for induction of labor is gestational diabetes. So when the doctor sees that it's more preferable for the baby to deliver, it's so important that they will plan for the woman, the pregnant woman, for her induction of labor. Another major medical reason is as a result of post-term. When the pregnancy is post-term, when the pregnancy is more than 40 weeks and 7 days, or more than even 40 weeks and 14 days, there is need to plan for the delivery of the baby, because at postpartum the placenta has actually decreased in its function. Placenta is the main organ that actually supply the baby with the nutrients and the oxygen that the baby needs in utero. So when the pregnancy is now post-date, the placenta is actually reducing its function. So it's better to prevent prolonging the pregnancy. For it's better to prevent the prolong of the pregnancy, to prevent stillbirth. This is so important. Those are some medical reasons whereby a pregnant woman may be planned for an induction of labor. We can all see is that it's for the health of the mother and for the health of the baby as well. What is now the elective reason for a woman to be planned for an induction of labor? Elective reason may be a reason that is known to the woman alone, that the woman, when a pregnant woman prefer to have the delivery of a baby. And some of the reason that women may likely say that the reason for them that they want to have induction of labor is because maybe they want their partner to be around at the time of the delivery of their baby, or maybe the time they plan for the delivery is the time that they know that their support system will be around to support them. So this may be some of the elective reason why a woman can request for the delivery of her baby or for her to be induced at a particular time. But they have to discuss this with their obstetric and gynecologist doctor. And when the doctor sees that this at that particular time, it does not pose any problem to the pregnant woman, likewise, it does not pose any problem to the baby. So the obstetric and gynecologist may actually plan for an induction of labor for them at that specific period. So those are the reason for planning for an induction of labor. Now moving on to the type of an induction of labor. Induction of labor can be conducted by the use of prostaglandin. This is a drug that actually mimics the spontaneous initiation of labor. It will allow it will mimic the normal hormone that actually initiates labor in a woman, which cause the contraction of the uterus, to the ripening of the cervix, and to the dilatation of the cervix for the delivery of the baby. Another method is now the mechanical method. This is when the obstetric and gynecologist or the midwives or any healthcare personnel that is attending to the woman during her induction of labor actually inflates Foley catheter into the cervix. For this method, the woman must at least be dilated. That means our cervix must at least be dilated by 1 centimeter before the healthcare provider will be able to insert a catheter into the cervix. So they will insert a catheter into the cervix, and if the catheter with normal
inflated with
sterile water and actually secure the tail of the catheter by plastering it into the thigh of the woman. And the catheter that's be inserted into the woman's cervix will actually fall on its own when the cervix is dilated enough. For example, when the cervix is dilated up to 4 centimeters, the catheter head will now fall on its own. So these has caused the ripening and the dilation of the cervix. Another method this type can actually used to augment a labor, maybe after the use of prostaglandin to start the induction, or using the mechanical method like the insertion of Foley catheter to initiate and induce a woman to fall into labor. But when the carer, the healthcare personnel sees that maybe the uterus is not contracting enough, this is when they can now use this method. They can now augment the labor by the use of pitocin or oxytocin. This will be added into a fluid and hang up and being given to the woman intravenously through the vein. This method can be used even if the woman actually fall into labor spontaneously. They can use it to facilitate and for the woman to have adequate contraction and for the labor to actually progress as expected. Another method that can be used to augment labor is the artificial rupturing of the membrane. This is when the healthcare provider, midwives, or the obstetric and gynecologists artificially ruptured the membrane by the use of amnio hook. By rupturing the membrane, this will cause the release of prostaglandin, and this will actually cause adequate uterine contraction. Another method that can be used to augment labor in an induction of labor is the striping of the membrane. For this particular method, the cervix must have opened to some extent, whereby the healthcare provider will use their examining finger to sweep around the membrane in order to initiate uterine contraction for the woman to actually have an adequate contraction. So these are all the methods of induction of labor and augmentation of labor. The use of prostaglandin, the mechanical method of inserting a catheter into the cervix, the use of oxytocin or the pitocin, likewise the striping of the membrane and the artificial rupturing of the membrane. Those are all the methods of artificially initiating a labor. So before a woman can be induced, there are some things to put into consideration. When a woman is being planned for an induction of labor, there is need for the obstetric and gynecology to actually consider these factors. There is need to have a Bishop's score, and what Bishop's score entails is to know that these women actually have a pelvic that supports vaginal delivery. The suitable pelvic shape for a woman to have a vaginal delivery may be spontaneously or through induction of labor is that the woman should have a gynecoid pelvic. This is the suitable for a suitable pelvic for a woman to have successful vaginal delivery. In this Bishop's score, it entails the position of the fetus, the lining of the fetus, the positioning of the cervix, and the consistencies of the cervix. Does this score actually, does this woman actually make a score that it will support successful vaginal delivery before they can be planned for induction of labor? And another thing they are going to consider the age of the woman, the parity of the woman, how many pregnancy has the woman carried to term, how many pregnancy has she delivered, is there any history of spontaneous termination of pregnancy, is there any history of voluntary termination of pregnancy? These are all the things that they are going to consider before they can actually artificially induce a woman. This is so important. because the baby must be lying longitudinally. The baby must not be lying oblique or in transverse. These are contraindication for induction of labor. So moving on to the contraindication for induction of labor. A woman with previous scar, maybe due to past cesarean section delivery or a scar from a procedure like myomectomy. Induction of labor is contraindicating in this case when a woman have a previous scar or due to cesarean section or myomectomy, and also the positioning of the insertion of the placenta is also something to consider. Is the placenta inserted into the lower uterine region? Maybe it may be closely to the cervix in case of placenta previa. So in some degree of placenta previa, induction of labor is contradicting in this case. Induction of labor is not without its own risk, even if it's being planned for the benefit of the mother and for the baby as well. But there are also side effects. What are these side effects? Number one, overstimulation of the uterus. In an induction of labor, the woman in labor must be
induction
monitored
of labor,
properly.
because there may be overstimulation and of the uterus, which cause the woman to be contracting repeatedly without having any space in between her uterine contraction. And this will not affect the woman alone. In overstimulation of the uterus, the woman will be exhausted. Likewise, this has effect on the fetus in utero. There's going to be fetal tachycardia, increased fetal heart rate, because the fetus in utero will not have time to recover from each uterine contraction. Normally, during contraction, the fetal heart rate slightly increase more than the normal patterns of that baby heart rate in utero. So when there is now overstimulation, there will be repeatedly increase in the fetal heart rate, which actually have effect on the baby in the uterus. There's going to be overstimulation of the uterus. There's going to be tachycardia to the fetus, increased fetal heart rate, and there may be uterine rupture. Rupture of the uterus can also occur. So these are the side effects of induction of labor. And a point of note is that a woman must be induced in a facility, in an hospital, whereby there is provision for alternative mode of delivery. So it's important that where a woman will be induced, there's going to be facility for cesarean section if there need be. In case of hyperstimulation, tocolytic drug may be given to actually inhibit the excessive contraction of the uterus. So it's so important. I've come to the end of the video. If you have stayed with me to this time, thank you for staying with me to the end of this video. Don't forget to like my video, to subscribe. Likewise, you can make a comment which I will attend to. Until next time I will be doing another video. Take complete charge of your health and save motherhood. Bye.